Hi everyone, my name is Andrés Acosta Ardila and I'm the Director of Community Relations with Pineapple Healthcare. And we're here today with a very special guest.
Hi everyone, my name is Milani Varela. I am all the way from Chicago, and I am a CDC Community Ambassador from the Let's Stop HIV Together program, and I'm also the Lead Navigator for Essential Support Services at Calor, which is an affiliate of AIDS Healthcare Foundation in Chicago.
Oh, well, thank you so much for coming all the way from Chicago.
Thank you for
What's the
having
weather
me.
out there like?
Actually, yesterday when I left, it was in the 40s, so being in this beautiful 90-degree weather is amazing.
We're actually here for a very special event that we're hosting. We're hosting an event called Mental Health Myth Busting. It's happening tonight. Uh, and it's basically going to look at mental health and break down all the myths that we have and misconceptions, especially around therapy and what we can do to access therapy. Let's start with the fact that you're a CDC ambassador, right?
Mhm.
So that's for the Let's Stop HIV Together campaign,
Yes.
right? I'm very familiar with it. I was also a CDC ambassador back in 2022. So, uh, but I am also a person living with HIV. So for me, it was it was kind of like an honor, like, oh, you get to be a part of this campaign that's educating people about HIV. Do you feel similarly?
Oh yeah, definitely. I mean, doing the work as an HIV negative person was different than doing it as an HIV positive person. So now being HIV positive, and being an ambassador really helps me connect people that are positive into treatment. And it helps me relate, and it helps me connect people because the same way that I'm navigating my healthcare is the same way that I can help other people navigate their healthcare. So yeah, definitely being positive has taught me a lot, and it leads to me teaching other people how to deal with their HIV positive status.
I always say that like the moment that I started accepting my diagnosis was when I started publicly speaking about it.
Hmm.
Because there was this cathartic experience that comes from it where you're just like, I'm owning it. And so if anybody else can get that, like that's really the point of it. So let's take that same mentality and apply it to mental health because I don't think we talk enough about mental health and the struggles that we face, right? So how did your diagnosis impact your mental health?
Ooh, I love that question because um, I didn't think it would. You know, once I got my diagnosis, right away, like not even a month later, I was given antidepressants, and right away I started therapy. So yeah, when I got diagnosed, it took a toll on my mental health because not because of the HIV part. Because I knew medically I was going to be fine. I knew with today's medication I was going to be okay. The reason it took a toll on my mental health was because I felt like I had betrayed my community. I'm like, I did so much as an HIV negative person, telling people, about prevention and all the methods they could do. And then I felt like I didn't listen to my own advice. So I'm like, how are people going to view me now? I felt like I had betrayed my community. But thankfully, one of my friends told me that all the work that I've done will not be erased just because of an HIV positive status.
No.
And that's what really, really helped a lot. Like, I'm like, you're right. It's not going to erase all the work that I've already done in our community. Um, and now I'm doing even more work now.
Yeah. And I think you hit on a really good topic, which is that idea of shame, right?
Hmm.
When you get that diagnosis, I was only volunteering at the LGBT center. I wasn't even doing like anything at the level that I am now. But after getting my diagnosis, I stopped going to the LGBT center because I was like, I'm testing people, I'm telling people this, and then I get it, you
Hmm.
know? And I think we need to remove that shame because HIV is one of those, like, it's a medical condition. That's what it is, right? But we attach this morality and value of morals to it of like, oh, I became HIV positive, therefore I did something wrong, therefore I
Hmm.
engaged in something wrong. And it's not that at all. Like, sex happens.
Yeah.
It's a normal part of life. And sometimes we're like, no one is 100%. And the difference between you and me is maybe I had one encounter where I did encounter the virus and you didn't, and that's it.
Yeah.
Yeah. Let's talk a little bit about what your mental health journey looked like after that. So, at one point, do you decide like I need to start therapy?
I got my diagnosis 1 month, my HIV positive diagnosis. A month later, I got diagnosed with AIDS. Um, then around that time, um, getting both diagnoses back to back, uh, really made me realize I did have a substance use disorder. My drug of choice is alcohol. So because of that, I started going to therapy. I was able to find a therapist, LGBTQ, thank God, because LGBTQ therapists are important. I was able to get into this therapy program where it was individual therapy and then group therapy. What was supposed to be only a 6 month program ended up being about 5 years.
Yeah.
Yeah, which I love. I love that, because of having good health insurance, I was able to get these services. It definitely made me realize that I did have a substance use disorder. I did have mental health issues that needed to be addressed. And I was thankful enough to be able to address it for, well, yeah, the past 5 years, I've been able to address my mental health.
That's really,
Thank
well
you.
done. Yeah. I relate to that, like I really do. I got my diagnosis, and I had always been a heavy drinker because of the Navy,
Mhm.
but after my diagnosis, there was this like feeling of being undesirable. It was back before U equals U was a thing, so it was just really a minefield in the dating apps. I went from being a normal 23-year-old to like being undesirable. And the only thing that really filled that gap is when I found meth. And that was my drug of choice, for it has been, Uh, and the sex that came along with it, the lifestyle that came along with it, it was the only place where I was truly status neutral at the time, where no one cared about my status.
Mhm.
That gave me something that no one else could give me, that nothing else could give me at the time, and it wasn't until years later, when I finally kept crashing and burning, that I was finally like, I need some kind of help. It's been a really difficult journey, but it's one that like, if I hadn't at some point said I need help, I think it would have been much, much worse than what it already was.
Yeah.
But let's talk a little bit about your CDC ambassadorship. How's that going?
Um, I guess they like me.
Yeah.
I guess they like me. This is actually my third time being an ambassador. So I was an ambassador in 2021. Then they asked me to come back in 2023, and then here I am again in 2024. So this is my third term, as I like to call them. So obviously I love pageants, and the first time that I became an ambassador in 2021, I call that my first national crown.
Yeah.
I That's the way I took it. I'm like, I'm recognized nationally. So being recognized nationally, being on the CDC website gives you, especially being Latinx, oh, it gives I don't know, it gives me this sense of empowerment. It feels cool, feels awesome being an ambassador. Honestly, one of the best things that has came out of this is the connection that I do have with other ambassadors. And what I mean by that is that, um since we're doing the work at a national level, there's people that from different countries, even especially from South Central America, that are looking for, and they're migrating to the US and they need HIV services. um they'll let another ambassador know, and then they help them connect with me, and I help them connect into treatment.
Yeah.
I find that so awesome. Like, that is, even though we don't it's not part of like the reporting portion, I find that the most powerful thing that we do, that we're able to connect people into treatment and HIV treatment and care, even though we are from different countries and different states, different cities. So I find that pretty awesome.
Yeah, no, I love how you call it the national
Yeah.
crown. Yeah. It's definitely a trippy experience to feel like, oh, I'm representing the CDC. Like,
Yeah. Yeah.
I remember, for here in Central Florida, we've had like a line basically of like ambassadors that, we had Christopher Cuevas, who was my friend, and then Gabriela Rodriguez, and then it was like, eventually it came to me, and I was like, it's my turn. But it was still very much COVID, so like I didn't get to do a lot of the traveling and everything. But what I did learn was how to spread messaging on social media.
Yeah.
And the place where I had the best luck was actually Grinder.
Oh,
Like, I had a
wow.
picture, my profile picture at the time was my Let's Stop HIV Together t-shirt.
Uh-huh.
Yeah. And there were a couple of people that actually reached out to me to Grinder, and I connected to services through that. And so I was like, oh, I can be an ethical slut, if you
That's pretty
will.
awesome. I didn't think about that portion. I mean, I know a lot of folks do like prevention work through Grinder, but now you gave me an idea.
Yeah. So let's talk about being Latino and being a CDC ambassador,
Yes.
right? Do you feel like we have enough Spanish materials to actually reach our population?
No. I do love that other ambassadors are speaking up about how we do need more of these materials in Spanish. I feel that they should be equally, everything that's already in English should also be in Spanish. regardless of the people that are pictured in the campaign.
Mm-hmm.
We need to send the messages whatever way possible. And if, the Latinx community, the numbers are still high with HIV. So I definitely think it's definitely important. Even the people in the ad campaigns, I do appreciate the diversity that there is. But yeah, definitely we need more Spanish.
We do, I think that, Jose Aguilar from Aguilar Salute, who's actually the one that,
Hmm.
connected and made this happen. He's actually fighting to make sure that
Yeah,
they have, and he's a fighter.
he
Once
is.
he's like, this needs to change, he
Yeah.
will fight until it changes. So kudos to Jose. I do appreciate the fact that the portal itself. So if you go to cdc.gov/stop HIV together, you can click on the Spanish version, and it does actually translate the website pretty well. There's still some parts where it needs to change, but the at-home test kit, it shows you how to
Yeah.
do that. It shows you how to get the anti-HIV stigma like campaigns, which I think those are great, especially because when we talk in Spanish, this is something that always bothers me. Like we always conflate SIDA with like VIH, like
Hmm.
HIV and AIDS is just automatically SIDA.
Yeah.
And that's something that we need to start teaching our Spanish speakers.
Yeah.
Like, no, there's a
Yeah.
difference, and language does matter. What's something that you would like to share with our audience here at Pineapple, as far as like staying in care, getting treatment?
I definitely think it's important to pay attention to other things that, because HIV, when we know HIV is not just getting on treatment, um, it's making sure you're undetectable, you stay undetectable, is making sure that you have a good mental health, is making sure that if you have other issues like substance use disorders, to address other issues. And not even that, there's diabetes that comes along with it, hypertension, like all these things from experience. Because I probably would have never found out I had diabetes if I wasn't going to my HIV treatment care, like appointments. That's the only reason I know that I have diabetes, is because of going to my, making sure that get my labs done and all that. So I definitely think it's important that, when we talk about getting people into care, that we not just focus on the HIV portion, but all the other things that come with being HIV positive too.
No, and you're absolutely right. And I will say that that's one thing that HIV positive people have that is actually a positive of knowing your status and getting into treatment, is that because you're seeing your doctor so often,
Mm-hmm.
they can actually start to treat other conditions, which leads to better health outcomes. I know that here at Pineapple, the reason we have a primary care model first, and then HIV and STI is something else that we do, is because we understand that in order, like HIV doesn't live in a vacuum, like you said,
Yeah.
and so you have to treat the whole person in order to be able to really address the epidemic.
And I
Um,
love that. I love that Pineapple does
yeah,
that, because it's important. Because there are some organizations that just focus on HIV, but in reality, it's like, no, we have to focus on the whole
exactly.
person.
And that's actually why we brought on Kim Murphy, our mental health therapist, because we understood that there was a need. So now if you come to us and you do receive an HIV positive diagnosis, you automatically get scheduled with Kim. You see her, the first session is free, and every session after that is only $40, unless you have insurance, which
Mm-hmm.
can cover it. So it kind of makes it accessible, and it makes it a priority that sometimes we forget. Like when you get your
Yeah.
diagnosis, you're so shook
Yeah.
that the last thing in your mind is like, I need to make all these other appointments for everything
Yeah.
else. Yeah. I know we talked a little bit about substance use,
Mm-hmm.
but I think it's important, especially here in Central Florida. Like we see the data year after year, and the highest co-occurring condition for people living with HIV is substance use disorder. And so it's something that we really do have to talk about.
Yeah.
Like there is help.
What I do want to say about that is something that I had to learn, the relapsing part. Um, there's so much shame that comes with when you relapse, but I want people to know that, hey, it happens. It's normal. I used to think the worst. But now I learned, relapse is part of treatment, like of recovery. It's part of recovery. And we can't expect to recover from one day to the other. It's going to take steps. It's a whole journey, for someone to get clean and sober. Um, but it's definitely, there's help out there. It's definitely important for folks to get into, the proper treatment. And I say proper treatment because not every program works for everyone.
Yeah.
Like I had to go through different types of programs until I finally found the one that actually helped. So it's definitely important to know where to go, which program is good for you, and which ones what you're going to stick to.
You are just speaking my language because I love harm reduction approach to mental health, to substance use. And here in Central Florida we need to grow those programs, right? Because we don't have a lot of alternatives. We have the 12 steps, and that's pretty much it. Like, we need to grow more alternatives to 12-step programs, because
Yeah.
it's one size fits all. It's not the approach we need to take to recovery, because you miss so many people that end up falling through the
Mhm.
cracks. And so it's like, if I didn't get it here, then I'm screwed. And that's not the case. There needs to be options, because we can't allow people to fall through the cracks, or just be like, you failed because you relapsed, therefore you're done.
Yeah.
Hmm.
Yeah. So growing up in a Latinx family, uh, when we talk about therapy, at least in my family, is for the white people, para los locos, right? For the crazy people. But we need to stop that. We need to stop uh, thinking that just because you're in therapy or you're taking antidepressants that you're crazy. Like, I just the word crazy alone, we shouldn't be using it. But I do want people to understand that it doesn't mean that you're crazy. You know, in our Latinx community, growing up, it's there's so much stigma with mental health that that's why people don't seek help. You know, and it's definitely something that people need to stop stressing over what people are going to think about me or what my family is going to think about me. It's important that if you feel you might have something that needs to be addressed, like your mental health, reach out to people, reach out to Pineapple Healthcare, reach out to, your friends that might know other people that can help you get connected to mental health services.
No, you're absolutely right. Aside from substance use, the other one that I've really struggled with is bulimia. And I remember when I first, like, try to explain that to my family. I was 14, and they just didn't understand it, right?
Mm-hmm.
Because they had never dealt with it or been faced with it. So it was just like, well, just stop. Like, it's like, I don't know how to stop. you know? And to their credit, like, the more that we talked about it, the more they've understood, like, that mental health is equally important. It's not
Yeah.
just about, like, they used to just say, coja ver la quera, like, be strong. And
Mm-hmm.
it's like, now they understand that mental health is something that needs to be addressed.
Yeah.
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 Oh, well, I just want to say thank you so much for joining us today. Like, I'm so happy that you're here all the way from Chicago. I think tonight's event is going to be wonderful. And, I just want to say to the people at home watching, make sure you share and follow, and that you send this video to anybody that you think might benefit from it. And last but not least, make sure you keep breaking the stigma. The more we talk about these issues, the more we break the stigma, and the more we normalize the fact that it's a normal conversation.
Yeah. Thank you for having me. Thank you, thank you. I really appreciate you having me here all the way from Chicago. It's important to have these type of conversations and these type of connections. So yeah, make sure y'all follow me, y'all follow Pineapple Healthcare, y'all follow Andres, and yeah, make sure that y'all talk about mental health with your family, your friends, and let's break that stigma.